¿Qué queremos ver?
¿A quién le está hablando?
A nadie. Se me está yendo la garganta, doña.
Escupa, pues. Escupa.
Pues no lo vas a ver, por favor. Pásame la bata.
¿Mande?
Pásame la bata.
Se lo pongo con la abertura para adelante, ¿no?
Sí, yo creo que sí.
Sí.
Ay, no. Ay, pensé que si me estaban sirviendo, pues no me estaban sirviendo. Puedo respirar, ¿qué le pasa? Ay, no. Que si era mucha sangre, que venga a ver.
¿No puede levantar la cabeza?
No, porque si la levanto se me va la garganta.
¿O sí?
¿Quién la puerta se
Hey. What's going on?
Esa sangre en la nariz.
I torn a vessel with my oxygen this week.
You what?
I torn a vessel in my nose,
Okay.
and I got in the shower, and it broke open with the water, and it's bleeding again like it was when it happened.
Okay. How long have you been trying to stop the bleeding?
Right now,
Yep.
I don't know, 5-10 minutes, I don't know.
Okay. So see this? Can I grab this? Go ahead and pinch at the bottom of the base right here and hold it tight. Keep your head forward. Try not to move your nose, itch, scratch, or anything like that. Can you remember? Oh, actually, I see your ID right here.
You are.
Thank you.
Oh.
I think we just transported you the other day.
Yes, it was due to this emergency.
It was for the same thing.
Yes,
Okay.
but I went in the shower and I went to see my doctor yesterday and he said that it was healing.
Okay.
When I got in the shower with the water, it opened up. Got it.
Did they give you any instructions for care?
Oh, they just asked me to use ocean spray.
Has that been helping?
I haven't even had a chance to use it, sir.
Okay.
I got freaked out with my oxygen and
Best you can. So try not to dab it or anything. I need you to like pinch hard and keep your head forward. I know it's really uncomfortable.
Can you do it down in my bicep because that hurts? I've lost a lot of weight and it pinches my skin.
Okay.
Thank you, sir.
So nose has been bleeding for about 10 minutes now, potentially.
I think so.
Okay.
Maybe that's why caregiver, she was here assisting me with the shower.
We'll get your vital signs here checked out.
Thank you.
So 10 minutes ago?
5 to 10, yeah. I know it's pretty uncomfortable pinching it like that, but once it pinches, that'll kind of allow the pressure right there will allow the blood to coagulate.
It did, but I had to, they asked me over 911 not to blow it or sneeze or anything,
Mm-hmm.
but I couldn't help it because I couldn't breathe through my mouth anymore and I couldn't breathe through my nose, so I had to blow it out.
Oh, and that blew the clot.
Yes. Unfortunately, they get very big clots,
Mm-hmm.
and I get them both in my mouth, and I get them or my throat, and I get them in my nose. So then I really can't breathe.
And when you had the vessel like done the other day at the hospital, I know you said they gave you the spray. Did they do any?
They gave you Zofran for the nausea.
Okay, but
That
they
was-
didn't do anything for your nose. It just stopped bleeding.
Not really, yes.
Did they tell you anything to be concerned about if it happened again?
They gave me the paperwork and they just sent me home
Okay.
a few hours later.
Okay. Well, if we can get the nose to stop bleeding, hopefully here shortly, I don't think it'd be a reason to go down to the hospital again,
No,
especially
I
since
agree.
you just came back there and they did that for you and they didn't really do much for your
I
nose.
agree.
Unfortunate for you.
You don't have to have any Vaseline with you.
I do not have like one thing. Unfortunately, we don't carry. I have like petroleum gauze, like this with petroleum on it, but I don't have actual just like Vaseline.
Okay,
unfortunately.
shut me down my throat again.
Yeah. So keep your head forward.
I am.
Like
Like, more for work?
yes, just like that. Because that'll allow the blood to kind of pool in your nose, and that's going to allow it to coagulate.
Yeah, it's
And-
coagulated in my mouth.
Because if it keeps going back down your throat, it's going to go down your stomach, and you're going to throw up.
Yes, that's what they said.
Mm-hmm.
That's why they gave me Zofran the other day. Because it was kept on coming back up from everything I had bleeded. And apparently, I bled, I think they said 75 cc's to 100.
Okay.
And I know it doesn't sound much, but it looks really ugly. My face looked horrible.
Mm-hmm.
And as you can see, you found me in a mess. I'm sorry.
No, it's all good. You didn't plan on that. You didn't plan on this. I don't think anyone plans on this happening to them.
Carlsbad medical alarm. Engine 104.
We'll check your nose. I'll get you some more gauze here in a second. We'll kind of see how it's doing. I'm gonna put your ID back here in your wallet.
Thank you. I gotta cough something out, sir.
What was that?
I gotta cough something out.
You have to cough it out.
Something has to come out, yes.
Best you can. Just don't blow your nose.
Oh, God. Are you guys busy this weekend?
It has been a very, very busy day.
Oh, God. I feel so bad for you guys.
Oh, you don't need to feel bad. It's what we do.
Killing for you. There's so many darn crazy people, especially when they're under the influence. I don't call those emergencies.
Here, I'm gonna trade you real quick.
Thank you. Oh,
Oh,
God.
there we go. It's starting to.
Yeah, it looks so nasty. That's why I didn't become a nurse. I was able to do hospice and I was able to be CNA, but no nursing. It's not for me.
Blood is not for everybody, unfortunately.
No, it's not. And I know it's not for me.
Encinitas. ALS response.
Do you still feel like it's pretty starting to bleeding still?
34. And medic 232. Belmont Village Cardiac.
Oh, that's good. That's a great sign. Just from that.
Does this mean I'm not going to be able to take showers in their bed, or what does this mean?
I think since it's still the vessel's still healing, you just gotta be a little more careful with it.
Does that mean I can't even touch my nose?
I think you could touch your nose. I would just be careful with like kind of rubbing your nose, itching your nose, or like just since like once the vessel's like
Heals?
yeah, and you get that clot comes loose, it's gonna bleed till a new clot forms.
Oh, God.
So just you gotta be careful till it like completely heals. So.
Like I said, I saw my primary doctor yesterday,
Mm-hmm.
and he did say that I had a scab, that it was healing. But I didn't think it was going to pop up and open with the shower.
Yeah, that's and it could have just been because like the warm water kind of broke
It
down
was
the
cold
scab.
water.
Oh, I don't know why then. It's a good, really good question.
I'm not showering with hot water. I used to, not anymore. I learned the hard way, but I did.
I feel some pressure in the arm one more time.
I just feel.
Well, it seems like it's starting to stop.
I hope so. Can I cough it up?
If you feel like you need to cough it up, absolutely. I would try to spit it up if you can. Like,
Mm.
you want me to give you the trash can right here?
Mm-hmm. Mm. Mm. This is so nasty. Who's here?
Just our other part of our crew. Anytime you call 911, we get the fire engine and the ambulance.
Oh. I appreciate you guys coming out here.
Of course.
See, buddy.
Just figure out a plan real quick. Just bloody nose. See for that Palmer the other day. Trying to see if it's messed up. Doesn't want to go. Just trying to figure that out.
Okay.
But if not, a couple hands for some assistance.
What time do we have?
It is just about 5 o'clock right now.
Ouch.
Big one. Like, the reason for changing your mind? Accurate.
It's on a forearm. I know you don't like the blood pressure cuff on your actual arm. Am I able to do one on there real quick?
Sure.
Just because this one's coming up really high.
Well, it's probably because I'm here. I tried to get showered. I tried to take care of the blood at the same time.
There's a lot going on.
Yes.
When do you usually take your high blood pressure medication?
I don't take high blood pressure medication.
You don't?
Because I normally run slow.
Oh,
I was actually admitted last October for low blood pressure.
okay. I feel a little pressure in this arm right here. Best you can. I'll hold this for you and keep this arm relaxed, okay?
Thank you. What is it coming down to?
It was 170 over 100 for this last one.
Madre de Dios. Actually, you know what? I have some Clonidine. I could take one of those, I suppose. Ouch, ouch. And I take it for nightmares. It's not for high blood pressure.
Well, I don't want you taking a medication for your. It's not for your blood pressure.
I take it because my psychiatrist gave it to me for nightmares.
Mm-hmm.
If I don't take it for my nightmares, forget it. My mom can't sleep next to me. I start shouting at her at night, screaming for her help.
Okay. Well, the blood pressure is still pretty elevated.
Uh-oh. It's not pretty, huh?
It's definitely up there. Like they're abnormally elevated.
Ay, Dios mío.
So real quick, she was seen yesterday, right?
Yeah,
What
abnormal.
was the solution for the bloody nose and Palmer?
Nasal spray, discharge paperwork. Followed up with the doctor yesterday. Had a scab. Scab came loose when she was in the shower. Started bleeding profusely. Bleeding stopped. More so, no like symptomatic or anything right now. Just was the bleeding.
You were gonna do anything for her high blood pressure?
Probably not. She's gonna refer to her primary care. Unfortunately, it's ma'am, you're not on any blood thinning medications, are you?
No.
Nope.
I take Lasix, but that's for retaining fluids.
Mm-hmm.
I retain fluids after COVID. Outside of my lungs and outside of my heart. I do have congestive heart failure and I have COPD
Okay.
and hypothyroidism and diabetes.
Anything like
Nope.
hypertensive crisis stuff?
Nothing.
No, I just don't want to.
Okay. Well, I'll get these things disconnected. It looks like it's stopping the bleeding right now.
I hope so.
Do we have one of those clamps?
We don't have any in our rig anymore. We used 2 yesterday.
Do you have any in the rig or?
We're like out in the rig right now.
Okay, we're out.
Do you have a different gauze?
No, we were talking about. We usually have nose clips. We're unfortunately out of the clips right now.
I have gauze. I have gauze.
I have more gauze though.
Oh,
Yeah, I got that.
I need a nose clip?
No, I was saying we normally carry nose clips. Unfortunately, we're out right now.
No, I'm saying if I need one.
Yes, ma'am.
I have one.
Oh, you have one?
Well, one of those like pinching clips.
Yeah.
Yeah, there you go. Yeah, just get some gauze, use one of those clamps, and you should be good to go. So, ma'am,
Yes, sir.
just wanted to talk to you and just let you know that you may have this issue, happen again just due to your high blood pressure.
Okay.
We definitely recommend you go talk to your primary care and try to get that under control if it's still a recurrent thing. But just letting you know that this might happen again because of your high blood pressure.
I normally don't run high blood pressure unless I see blood or something's going on. Like I said before, I was admitted for low blood pressure.
Well, right now you have high blood pressure.
Okay.
That's what we're seeing, and that makes sense with the recurrent nosebleeds.
Okay.
So, with that, I would try to schedule an appointment with your primary care,
Uh-huh.
and just let them know about this last episode you had. You've been running high, you've been having recurrent, nosebleeds that haven't really been able to self-resolve. Those are symptoms of hypertensive crisis. You're not showing anything super concerning like headache or blurred vision, but this could be the start of a new problem.
Oh God.
Yeah. So,
Like I need to add to my medical record.
well, just wanted to make sure that you were, you know,
That I understand
informed
what you're
of
saying.
everything that's going on. You know,
Okay.
this could be the cause of something new, but could not be. But you need to go to your primary care and get this figured out.
Again.
Yeah.
What do I do if it happens over the weekend?
You know, you can call us anytime you want. You know, just call 911. Or like I said, you have that nose clamp. Best thing to probably do is to either use gauze and that nose clamp and just keep that clamped as long as you can stand it, and hopefully it clots up again. It sounds like that clotted up last time it happened, so you have no issues clotting. It's just it keeps rupturing.
And like kind of how we did it just earlier, how you pinch the base of your nose.
All night. Now that I think about it, I did have a headache most of the night. I didn't rest well, and I started having not chest pain but chest oppression last night.
All right. Well, I mean, did you want to go to the hospital, or did you not want to go to the hospital?
I really don't want to go.
Okay.
I was just there, and I don't like to live there, sir.
Yeah.
It's not for me.
Well, with all that said, you know, just keep that in mind. We'll go ahead and have you sign a form saying that we checked you out, and you don't want to go to the hospital, and then we'll get out of your hair. Okay?
Thank you, sir. I appreciate you guys coming down.
Yes, ma'am. Where's that nose clamp so we can grab that and get that to you?
I'm thinking about one of those the ones that I use for papers.
That's a little rough on the
I would say
nose.
that's gonna be a little uncomfortable.
Ay, Dios mío. Okay, what about a close clip?
That could work.
Could work. It might hurt a little bit, but sure.
The goal is you want to get it on the bottom of the base of your nose right there, kind of where we were pinching.
Uh-huh.
Right there. That is where the best place to get it and keeping your head forward.
Okay, I'll have that in mind. We'll have to go to the clothesline and find one.
And then you could probably even order like Amazon, like nose clips. They have like soft ones.
Yeah, but it's not going to show up today.
That you'd be surprised. Amazon's pretty advanced nowadays. But it's just saying we evaluated you. If you need to, I'll wipe it off at the end. Don't worry about it.
Tell them my signature was perfect today.
It was beautiful.
Thank
Well,
you.
Margaret, sorry we had to see each other like this again.
I'm so sorry you had to come back out.
Not a problem.
If you guys need a bug. Oh, you know what? I owe a bug to your fire agency. I owe it to the brand new fellow that's 2 months in with you guys.
Oh.
He's about almost 7 feet tall.
Oh, I know exactly who you're talking about.
Yeah, I'm
It's
sure you
Jack.
do.
Yep.
Yes, that's him. Do me a favor, take him a book.
Okay.
He said he wanted one.
Okay. Well, hopefully we get this resolved and we don't have any issues here. If you need to call us again, we're right down the street, okay?
I appreciate it.
I
Thank
sure
you.
hope you have a good rest of your weekend, okay?
You too.
Thank you.
¿Qué?
Me dejaron gases. Mire, tráigase la cajita de mis pastillas, por favor, para que me tome una de la alta presión. Dice
Sí.
que mi presión está saliendo muy alta y que a lo mejor es por eso.
¿En la cajita están?
Sí, ahí pongo las de la noche, o sea, nomás me la tomo para las pesadillas.
¿Tiene en la sala la cajita o dónde estará?
Ahí está enfrente en el gabinete, cuando me siento yo arriba de la cajita blanca. Ahí está en medio, no se ve, pero ahí está.
¿Aquí en su cuarto?
Sí.
A ver.
Ah, no me trajo agua, ¿verdad? Se me olvidó decirle.
¿Traigo la de pepino?
Sí, no importa.
Tiene alta la presión.
Piensan que por eso lo está cocinando, se están reventando las venas. Dice que algo está pasando en mi vida que está ocasionando la presión alta, porque le digo que al contrario, que siempre me han dejado en el hospital porque tengo la presión baja. Y dice que estaba 170 sobre 100. Eso es mucho, eso es demasiado. Por eso me querían llevar. Pero ellos no me pueden dar esto. O no deben.
Oh. ¿Pero ya no le está saliendo?
No, ya se coaguló. Gracias a Dios. Ay, pinche pastillita se quedó atorada. No se fue.
Tómele más.
No, se está en la garganta por la sangre.
Oh.
Ah, que la canción.
Ahí la siente.
Ya se fue. Ah, pues ahora que le digo. Ahora que le digo, pues ni modo, sáqueme y bañeme afuera. No me bañe, ya me tallé la cabeza una vez. Lo que no alcancé fue a tallarme. Pues ahora juegueme afuera con una toalla, no importa. Con las toallas mojadas no le hace.
Porque no se puede meter, ¿verdad?
No, me va a pasar lo mismo. Si me meto me va a pasar exactamente lo mismo con el agua. Se rompió con el agua.
Sí.
Se abrió con el agua. Pensaban que el agua estaba caliente. Yo no me estaba bañando con agua caliente, el agua estaba más fría que caliente. ¿O para qué quería que me metiera? ¿Mande?
Dice tu mamá que como la presión, digo, porque dice que alta. No alcanza la... Bueno, traigo otra toalla.
¿Quiere que me metiera para... ¿Quiere acabar de bañar aquí?
Pues yo digo, pero... ¿Usted cree que
Pero usted
no?
va a llegar más tarde a su casa.
No, pues hasta que se quede. Mi marido ahorita le hablo a mi hijo. Porque necesita echarse jabón para que no huela.
Ah, que la canción, en eso no pensé. A ver, pues entonces métame la silla para atrás otra vez, por favor. Espérame, déjeme levanto.